Hi everyone, my name is Dr. Hilary Booth and I'm a naturopathic doctor, and welcome to my video blog. This week we're going to be talking about something that affects a lot of people, but unfortunately it's often not diagnosed at all or it's misdiagnosed, and it's called SIBO. And SIBO stands for Small Intestinal Bowel Overgrowth. So the thing that makes SIBO unique compared to some other digestive disorders is that it takes place in the small intestine rather than the large intestine. In a healthy individual, what happens is we have a very small amount of bacteria, relatively speaking, that colonizes the small intestine, and a much larger amount and different types of bacteria that will colonize the large intestine. In a healthy person, when we eat food, it travels down our digestive tract through our stomach into our small intestine, where the food is further broken down and a lot of nutrients are absorbed. Because there's a small amount of bacteria there, it doesn't quite interfere, it actually helps that process. And then it moves on into the large intestine, where it meets a larger amount of bacteria, and because at this point the food is primarily broken down, there's hardly anything left for the bacteria to feed on. And so instead, you have a healthier relationship between what's in the digestive tract and the bacteria that are living there. And those bacteria will help with the interfacing with your immune system and with your hormones and some other things. But the important thing to note is the difference between what is in the small intestine and the amount of bacteria there versus what's actually in the large intestine, which is closer to stool, and the larger amount of bacteria that colonize there. Now, in somebody with SIBO, what has happened is the amount and types of bacteria that normally colonize the large intestine have actually gone and overgrown the small intestine. So there's a very large amount of bacteria that shouldn't be living there, that is living in the small intestine. And when the food comes down into the small intestine, the amount of bacteria that are there actually feeds and feasts on the food in the small intestine. And this feasting can cause bloating, gas, digestive upset, diarrhea, and constipation, and lots of other issues in the body. Now, in someone who has a healthy digestive tract, they should be absorbing things like vitamin A, vitamin D, and B12 in the small intestine. However, in someone with SIBO, they won't be absorbing these things because of the wrong types of bacteria living in the small intestine. So this can lead to other things. It can lead to whole body inflammation, which causes things like joint pain and headaches and severe amounts of fatigue, as well as a lack of certain nutrients like vitamin A, vitamin D, and vitamin B12, which can lead to low mood and, again, lots of fatigue and frequently getting cold and flu. So you're sitting there thinking, okay, I may have some of these symptoms, but how do I know if I'm at risk for actually developing SIBO versus just run-of-the-mill IBS? SIBO develops in people who typically have low stomach acid. So this means if you're taking Tums, if you're taking proton pump inhibitors for heartburn, things like Nexium, for example, you may be at higher risk. Also, if you're taking medications like antibiotics, the birth control pill, or drinking alcohol, those can also kill off the good bacteria, making it easier for the bad bacteria to colonize in the small intestine. Now, if you have some of these risk factors and you're experiencing the symptoms, you may want to think about doing some testing, and the testing is actually really quite simple. Now, what the testing is actually a breath test. So what happens is when the stomach, or the bacteria that live in the small intestine are overgrowing, and they're going to start off-gassing or producing a lot more of certain types of hydrogen and methane. And what that does is we actually exhale it through our lungs. So the breath tests that are done are actually just measuring the amount of these certain types of particles in our lungs and in our exhalation, and that can diagnose whether or not you have an overgrowth of bacteria in the small intestine. Now, if you do have a diagnosis of SIBO, the treatment plan can be quite arduous because you have to actually kill off the bacteria that's living in the small intestine, and this can be hard to do. So MDs will use different types of antibacterials or antibiotics in order to kill off the bacteria, and NDs can use different types of herbal antimicrobials, or they can also complement what your MD is doing. Things like oil of oregano or olive leaf extract and berberine and allicin from garlic are all great antimicrobials that your ND might use as part of your SIBO protocol. The other thing that's really key to note is that bacteria is smart. It puts up a wall or a shield called a biofilm, and that can actually repel some of the antibacterial action that we're trying to do. So it's important to try and break down that wall by using supplements like NAC and certain digestive enzymes. Now, if we're doing all this, it's also important to note that we need to be making dietary changes as well, partially to mitigate some of the symptoms that you're experiencing, to make it more manageable for you, but also to stop feeding the bacteria that's overgrowing in the small intestine so that it can be more effectively killed. Some different diets that are really effective include the FODMAP diet or the specific carbohydrate diet. And both of these are difficult to follow, but totally worth it if you're experiencing these symptoms. It's also really important to retest after your treatment protocol to see that the SIBO has actually been eradicated, because a lot of times it takes multiple rounds of treatment to actually see a full remission. And we can see a recurrence of SIBO in about 50% of patients. So it's really important to be doing those breath tests as needed to monitor your treatment progress. So if you're experiencing any digestive issues, bloating, gas, pain in the abdomen, digestive upset, constipation, or diarrhea, it's important to seek out naturopathic care to do the appropriate testing to diagnose you properly, and then also to develop a treatment plan that's right for you. If you would like to book an appointment with me, you can do so at our website at www.daruwellness.com or by phoning our clinic. Thank you so much for watching, everybody. I hope you have a wonderful week. Take care.